Hello, Yarmouth residents. This is Bruce Murphy, Director of Health for the town of Yarmouth, with a coronavirus update. Since the beginning of March, there has been 953 positive cases of COVID within town. Currently, there are 89 active cases. We've had 27 deaths. These cases have been spread pretty much throughout town, as we would say, community spread. As you'll see, West Yarmouth has had 403 cases, South Yarmouth 380, Yarmouth Port 170, for a total of 953 cases from the beginning. You can also see how we've broken it down by age categories. And as we've seen in the younger ages 0 through 19, we've had 47 cases up to age 10 and 68 cases up to age 19. From there, you can see that it levels out between several of the age brackets. Between the age 20 to 60, you can see that they're pretty close together. The younger group, which I'm going to call between 20 and 40, you can see the numbers are pretty close together. So that gives us the total of 953. The breakdown between male and females, we can notice as of today, 420 males and 533 females. Now you'll see the chart of the number of daily cases, active cases that we follow. As you can see, from March and April, the number of active cases that we're following ranged anywhere between 20 to 30 with a high of 40 cases. Then it kind of leveled off in June, July. We went 20 days without any cases that we're following. And then you can see it going back up in October and November, where we were following anywhere between 70 and 80 active cases for a day, which is more active cases in November than all of April and May combined. As we continue to go through in December and January, you can see the number of active cases that were being followed had risen to 150, 160 to 170 cases that were being followed. And we're still in that surge of cases being followed. The next chart shows the number of deaths that we've had in town from the beginning. The 27 deaths, how they've been spread out from March to April to recently December and January. The average age of deaths was 63 through 99, with an average age of 86. I would like to just mention where we currently sit in Yarmouth with the number of tests and cases that we have. Yarmouth right now is currently the 8th consecutive week in red, a high-risk community. This is based on over 3,000 tests over the last 14 days, in which 181 cases were tested positive, for a positivity rate of 5.87. This is below the county average and just above the state average for positivity. A lot of the testing is coming from the nursing homes and healthcare facilities that are testing residents and staff 2 to 3 times per week. I need to remind everybody about precautions people need to continue to take. It's something that I mention each week, but we're still seeing, as we do contact tracing with the VNA and state contact tracers, a lot of the same positive cases coming through either gatherings, dinner parties, birthday parties, sleepovers, and play dates. It's so important to avoid these type of events. Also, if you don't feel well or are waiting for a test, please stay home, wait for the results, and do not go to work. We've had several cases recently that people, while they were waiting for test results to come back, they went to school or went to work, which then increased the number of potential close contacts. To help us stop the spread, mask up, social distance, wash your hands frequently. As part of the precautions, also mentioning that for food options available in town, people should contact the senior center, which has several grab-and-go programs and other programs to reach out to seniors, along with our active food pantry. Currently, the state has a 3-phase vaccination rollout. Phase 1, which was first responders, nursing homes, and so forth, is just being completed now. Phase 2, which the governor says will start in February, is based on February to April. And that's based on if the vaccine is available from the state. With Phase 3, the general public in April and June. I'd like to zero in on what Phase 2 is. Phase 2, the governor said, would start February 1st, but that is based on only if vaccine is available, which at this time it is not. But once it becomes available, the first group within Phase 2 is individuals 75 and above, which will then be followed by people age 65 and above with 2 comorbidities. After that, it will go further in Phase 2. The vaccination plans that we've been working with for several months with the county is all planned and ready to go, and again, based on when the state will be providing sufficient amount of vaccine for 4 to 5 regional ongoing clinics on the Cape. There'll be one Massachusetts Cape vaccination site in the Mid-Cape area. Also, local pharmacies, Stop and Shops will have vaccine available. I am currently in discussion with our VNA to discuss homebound residents, how they will be served by vaccination, and as soon as that becomes available, we will reach out and inform the public on that. How we will get this notification on vaccine out to the states will be done in several ways. Town social media platforms, the county helpline, code red calls, message board signs, and also YouTube videos that we're making now. So if you want to keep also updated yourself and have questions, the county has a county vaccination helpline staffed Monday through Friday, 8 a.m. to 4:30. Also, you can monitor the state DPH COVID locations at the following: maimmunization.org. Thank you for listening. Thank you for staying in touch. And remember, be safe, mask up. Thank you. Good afternoon. I'm Bruce Murphy, Director of Health, with Jeff Colby, Superintendent of DPW, and just wanted to touch base with you on how the COVID affected your DPW over the last year.
Absolutely.
And I know you worked closely with the Board of Health on the beaches in the summer, watching the parking lots and working with recreation. You want to just say how that went?
Sure, that was a challenge because a lot of people in town, but we also had to work more closely with the lifeguards and the parking lot staff than we ever have before. We had to coordinate to see what the capacity was at the beach, and when that was reached, then close the parking lot. So it wasn't as it has been in past years where we would build a parking lot and then shut it down.
Right.
Much more coordinated effort to make sure we're keeping people safe and proper distances were set, and then we'd shut down the parking lot.
Yeah. Well, I appreciate the close work with the Board of Health and the recreation. I know it was a busy summer at times with the weather, and there was a lot going on, so I appreciate all that cooperation between the departments.
Absolutely. And the beaches was one of the things you could do in the summer,
right,
whereas many other things were closed. So
right.
It was important.
It was important, so that's good. I know you do a lot during the year. I don't think probably the town realizes how much the DPW is into, between doing trash pickups, the beaches, keeping the water system going. Anything else you would like to touch base with, of the many facets that you provide the town services?
Well, certainly highway and town buildings that get maintained, that's been very important. We've had to increase the requirements for the cleaning contracts within town buildings because of COVID, so that's been a significant impact that we continuously work through and make sure the proper jobs are getting done. So that's been an impact. We try to keep people separate as much as possible on crews, or within plow trucks,
Yeah.
just one person per vehicle. So that's been an impact for us.
Great. And with the little storm that we just had today, I mean, or last night, I know we got 3-4 inches on the road. You're out there plowing and sanding. How's that going this season for you?
It's going about as it has in previous seasons for us. We can always use a few extra contract drivers if possible, but we cover all the routes, whether it's with internal staff or the many contractors that we have that come in and plow for us. And that's an operation that can essentially be kept the same because, again, as I mentioned before, one driver per truck, just keep people separate, make sure you're not coming in at the same time to check in or check out, just making sure you're physically distanced as much as possible.
Great. And I know you got miles of roads to do, so people just need to be patient during some of these storms, that you will be out there plowing, because it's a lot that you have to do.
Absolutely, and a lot depends on the amount of snow. We've been very fortunate so far to have some fairly light storms, which is good, so we can keep up very easily. But it's those bigger events that gets even more challenging on equipment and on personnel. Even last night's little storm, we still had people that were essentially working all night and then continued to do their job during the day. So I've got to send out a huge shout out and thank you to all of the public works personnel that keep the town opened and maintained and continuously working hard to make that happen.
Great, great. And I see you got a great new building going up on Buck Island Road, and that's coming along on schedule. I know people are driving by and say it looks terrific. And when's that operation switched over to get that up and going?
Yeah, on schedule and on budget, I like to say.
There you go.
Is, hopefully we'll be in there the very beginning of May, and after that we'll be wrapping up the other site work and be completely done by this summer.
Great, that's great. I know we're all looking forward to the ribbon cutting on that one.
Absolutely, and hopefully we'll be out of this COVID situation where we can actually do that with the big scissors.
There we go.
If not, we'll figure out something virtually or somehow to manage that. We'll figure it out.
All right, that sounds great. Well, thanks very much for meeting with us, and we'll be staying in touch with you over this winter.
Great. Thank you very much, Bruce.
Thanks for watching. For daily updates on the total number of cases, please visit the town's website. Thank you.